Hi, I'm Terry Wilcox, and this is the State of the Patient podcast. Every patient has a number that nobody warned them about. It's a denial letter, a copay, a bill that shouldn't exist. My stepmother's number was 40. 40 years at the same job, Colorado Hospital Association. She was the director of education and member services. She was good at her job. She didn't want to leave it. But she left it anyway because she started forgetting things, and they started taking responsibilities away from her, hiring new bosses over her, and eventually there was nothing left to take. She wasn't ready to retire, but her brain retired without her. Nobody tested her. There wasn't a test to give. Her name was Sandy, and she died last week on July 31st. And there is a blood test on the market right now that, if it had existed, it might have found what was happening to her 20 years before it took her job. Except most people still can't get one. That's the show today. I want to tell you about Sandy, but I want to be careful because I know what happens when someone talks about a person they lost. Every one of us has amazing loved ones. We all think ours were the funniest, the kindest, the ones who made the room better. And obviously, I think that about Sandy. And you'd be right to say, sure, Terry, of course you do. So I'll try to keep it short. She was glass half full in a way that should have been annoying, but somehow it never was. She was always laughing. She had cat things all over her house, which was funny because early on she'd told us she was absolutely not going to become the crazy cat lady. She was always ready to hug you, listen to you, help you sort out whatever mess you'd made, tell you about whatever mess she'd made. And she didn't always have the answer, but she always wanted to sit there until you found it or found a new way of looking at it. There was usually ice cream or a chocolate cake involved. Later on, a glass of wine or an old-fashioned. She showed cats, Himalayans, beautiful ones. She took them all over the country and once as far as Russia. Their names were things like Luke, Leia, Yoda, Pixie, Wizard, Dennis, Mr. Mistopheles, Quigley. There were so many over the years. And the funny thing was, I'm just going to tell one little backstory, was when they first started dating in the early 80s, she asked my dad, she said, what do you miss most about your family? And of course, the first thing my dad said was me. But the second thing he said was, I miss my cat, which was my cat, actually, and her name was Buffy. And Sandy didn't hesitate twice. The very next gift she got him, which I believe was for Christmas, she got him a Himalayan cat, and they named her Leia. And then they decided Leia needed a friend, and so they got Luke. And then Luke and Leia had a baby, and that baby was Yoda, and the rest is really history. And when she died, her goddaughter, Gennifrey, who's one of my closest friends, said there would be at least 1,000 cats waiting for her at the pearly gates. At least 1,000. I think Gennifrey's probably low on that. But that's not what I'm here to talk about. I'm here to talk about Alzheimer's disease. And I'm going to talk about Sandy specifically because the shape of what happened to her is the shape of what's happening to millions of families right now. I want to be careful how I say this. I can't tell you Alzheimer's was preventable. Nobody can prevent this disease yet. And most of what went wrong for her went wrong because the tools didn't exist, not because anyone made a bad call. But almost every one of those tools does exist now. That's the whole difference. What happened to Sandy was a limitation. What happens to the next 58-year-old is a decision. And here's the first fact I want on the table. Sandy's mother, who I called Grandma Roberts, she also had Alzheimer's, but she lived to be 98 years old. I remember her in her 70s, coming back from overseas trips. She would hand 12-year-old me a gold lame lipstick holder I had absolutely no use for. She was the life of the party. I adored her. And as Sandy aged, I realized she was exactly like Grandma Roberts. But there's a huge difference. Sandy died at 80. Her mom died at 98. This disease didn't just kill my stepmother. It took 20 years almost off a woman who came from people who lived to be almost 100. It took the end of her working life and the beginning of her retirement years, her ability to travel, her ability to continue to show her cats, and any chance of her really getting to see her grandchildren as they grew up. Now, 20 years, I want you to remember that number. People call this the long goodbye. I understand why, and I've used that phrase myself, but it's gentler than the thing it describes. A goodbye is something you get to say to someone who knows you're saying it. Alzheimer's takes the saying first. Now, here's where I want to get precise because there are actually two different failures stacked on top of each other, and people can conflate them. The first gap is biological. Alzheimer's disease starts in the brain long before anyone notices anything. Research published in the New England Journal of Medicine found that the neurological changes and biomarker changes begin 15 to 20 years before the first clinical symptom. Earlier work out of the DIAN study, that's DIAN study, that's the International Network studying inherited Alzheimer's, put it at more than 20 years. 2 decades of disease running silently in a person who feels completely fine, who's working, taking cats all over the world, planning a retirement she's going to lose. Nobody experiences that gap. You can't. That's what makes it a gap. The second gap is the one I lived. My dad lived. Her friends and family lived. And anyone who has ever loved someone with early onset Alzheimer's has lived. That's the stretch where the symptoms are absolutely obviously there and still nobody says a word. Sandy was forgetting things at work. Her employer of almost 40 years noticed enough to start pulling her duties. Her family noticed. She even noticed. And the machinery that's supposed to catch this didn't engage. Not because we were stupid or in denial, but because in that era there was no simple, accessible test to hand a 58-year-old who says something feels off, or the family that says something feels off. Confirming Alzheimer's meant a spinal tap or a PET scan. Expensive, invasive, not something a primary care doctor orders on a hunch. So you get told it's stress. You get told it's menopause. You get told it's normal aging. It's a lot on your plate right now. We did have one researcher take a picture of her brain somewhere around 2007 with a new imaging test that was supposed to catch Alzheimer's early. Sandy took it. It came back negative. My dad and I looked at each other even then and said, that test is going nowhere. And it hasn't. And the years go by and the window closes. And by the time anyone puts a name on it, the name doesn't help anymore. Those two gaps are why early detection is the entire ballgame. Because everything we have, every treatment, every financial plan, every legal document, every honest conversation with your family about what you want, every single one of those things only works if you're inside the window. Sandy was never inside the window. There wasn't a window, there was a wall. Now let me tell you what happens on the other side of that wall, because this is the part of Alzheimer's policy that gets treated as a footnote. And it's not a footnote, it's the whole load-bearing structure. More than 12 million Americans are unpaid caregivers for someone with Alzheimer's or another dementia. Last year, they provided an estimated 19.6 billion hours of care. 19.6 billion hours. The Alzheimer's Association puts the value of that labor at $446 billion a year. Unpaid. Absorbed entirely by families. That is not a gap in the American dementia care system. That is the American dementia care system. And I want to say something about dementia caregiving specifically because it is not like other caregiving, and we keep pretending that it is. If you're caring for someone through surgery or through chemotherapy, it's brutal. I've been there. I've loved and lost people. But the person is still there. They know you. You're in it together. With this, at some point, the person stops being there. They stop knowing you. They may accuse you of things that never happened. Sandy went through stretches where she'd tell me flatly that my dad had left her for another woman. He hadn't. He was her husband until the day he died. And the thing about Alzheimer's is that you can't argue with it. You can't correct the record. You can't produce evidence. You just pat them on the hand, agree that it sounds hard, and you go out to your car and you cry. Because the person you love isn't in there. And she's still going to not be in there tomorrow. She brought a date to my father's funeral, her own husband's funeral. She brought a date. She was too far gone to know where she was or who she was burying. Of course, I didn't say no. That was her friend from inside the memory care facility. Now, here's the part where I have to be honest about my own limits, because I think a lot of adult children are carrying guilt they shouldn't be carrying alone. I did not bring Sandy into my home because I couldn't. I had 2 young children. My mother-in-law was already living with us. My dad was recovering from a broken leg. Our miniature schnauzer, or my mother-in-law's miniature schnauzer, Harlow, terrified Sandy. We had too many stairs. My dad couldn't get up and down. Sandy couldn't really get up and down. I didn't have the house. I didn't have the hours. And I would have taken everybody. As a kid, I genuinely wanted my whole family to live on one cul-de-sac. I still think community is one of the most beautiful things there is. And my idea of heaven, even when I was a kid, was when I die, I hope where we go, I get to live with all my family on a big farm. But wanting it and being physically able to do it are 2 different things. And 12 million Americans are currently standing in that exact gap. That's not a personal failing. That's a policy failure. We built a system that assumes a family member, almost always a woman, will simply absorb a 5 to 15-year illness with no money, no training, and no relief. And then we act surprised when caregivers get sick themselves. One more thing, and then I'll get to what we do about it. My parents waited too long to move near me. They came kicking and screaming at 73 when Sandy was already mostly gone. So if you are of retirement age and you're listening to this, I implore you to go be near your children. Please. Not because they don't love you, because they are working and raising kids and they physically cannot relocate their whole life to you when the emergency comes. And it will come as an emergency. It came as one for us. Go early while it's your choice and not a crisis. My parents arrived so late that I had to place them the day the country shut down. March 17th, 2020. I got a call 3 days out. If your parents aren't here by 6 o'clock on March 17th, we can't let them in. That was the choice. Move them into assisted living immediately, sight mostly unseen, or have no place at all. I put Sandy in assisted living rather than memory care so she could keep a cat. Looking back, she probably needed memory care sooner than I admitted, but she was still her enough that it didn't feel right yet. Then the doors closed for a very long time. My dad only lasted a few weeks. He came with a lot of comorbidities. And when he passed away, that's when things really started to unravel. I want to talk about what COVID did to people with Alzheimer's because I don't think this country has ever really reckoned with it. Here's the thing nobody accounted for. You cannot explain a pandemic to somebody living with dementia. Everyone else in America in 2020 was afraid on some level, I suppose. We understood why we were isolated. We had a reason to hold on to, a bad reason, a frightening reason, but a reason. People living with Alzheimer's got none of that. You could explain the virus to Sandy and 30 seconds later it was gone. There was no fear. The mask was a costume. Fear requires you to hold a threat in your head. There was no patience because patience requires you to believe the thing will end. There was just, my family stopped coming every day for months and months, fresh each morning, with no explanation that stuck. That's not isolation, that's abandonment. Experience brand new every single day. And when they finally opened things up a crack, what we got was this. They put this kind of plastic box outside, and they gave us a karaoke microphone and speaker, One microphone only, though, which you had to pass back and forth to each other so you could hear through the plastic. I don't even want to start with the irony of that. So first, I would go behind the plastic where she had already removed her mask because, as I told you, she thought it was a stupid costume. I'd unwrap the sandwich we were supposed to be having lunch together with. I'd hand her the microphone and walk her through turning it on, which was its own complicated procedure. Then I'd walk back to my side and she'd try to talk, and then she'd get confused and put the microphone down on the table and take a bite of her sandwich, and then forget to talk in it at all, and then just start talking through the plastic. My son James finally just walked around the plastic and sat down next to her. And he said, "Mommy, I just want to sit by Nanny. I don't want to talk into this dumb microphone. Neither does Nanny." He was 6. He was right. It was ludicrous. And I want to be fair. The facility where Sandy was great. They were doing their best inside rules written by people who had clearly never sat across a sheet of plastic from someone with dementia. But this is what happens when we write policy for the average patient and forget that there is a person behind every patient. Sandy declined faster in those months than she probably would have otherwise. I'm certain of it. So is every family I've talked to since. Now here's the part that should be good news, and it is, and then it isn't. The FDA has now cleared blood-based tests that detect the biological markers of Alzheimer's. The Lumipulse p-tau 217 amyloid ratio test and the Alexis p-tau 181 test. Cleared for adults 55 and older. A blood draw. The same tube they already fill at your annual physical. Everything Sandy didn't have. The spinal tap, the PET scan, the specialist referral, the wall, all of it collapsed down into a blood draw. Now, I want to be careful here because this is where a lot of well-meaning advocacy can get sloppy, and I'm not going to do that. A blood test is not a treatment, and finding amyloid in someone who has no symptoms at all does not today make that person eligible for anything. The treatments we have for Alzheimer's are approved for early symptomatic disease. That means mild cognitive impairment due to Alzheimer's or mild Alzheimer's dementia. You have to have symptoms, but early ones. And you have to have the biology confirmed. So the gate is not your age, the gate is your stage. Now let me walk you through what qualifying actually requires, because almost nobody says this out loud, and I think every family should know who might be thinking about this. You need to be in the early symptomatic stage, mild cognitive impairment or mild dementia, not moderate, not advanced. You need confirmed amyloid pathology. That's a PET scan or a spinal fluid test, and increasingly a blood test to decide whether those are even worth ordering. You need genetic testing beforehand to understand your risk of a specific brain swelling side effect. You need a baseline MRI, and certain findings on it rule you out. And certain medications rule you out, including common blood thinners. That's a real workup. It's not a vending machine, and I'm telling you all of it because I want you to understand the actual shape of the thing we're fighting for. Now I want to put Sandy inside of that. At 58, she was starting to forget things at a job she'd done for nearly 40 years. Her employer noticed enough to start pulling her duties. She noticed. We noticed. It was mild cognitive impairment. That is the treatable stage. That is exactly, precisely the window these therapies are built for. Her age was never the barrier. The trials for these drugs enrolled people from around 50 on up. She was young for it, not old for it. What she didn't have was a test that worked, not a test nobody ordered, a test that wasn't there yet. One experimental scan that told us nothing, and beyond that, a spinal tap or a PET scan, which no primary care doctor sends a 58-year-old for on a hunch. So she got told it was stress, it was age, it was a lot on her plate, and by the time the word Alzheimer's got said out loud, She was years past the stage where any of this would have mattered with the current tests we have. Sandy didn't miss the treatment because she was too old or too young or the wrong kind of patient. She missed it because the innovation hadn't arrived yet. And that is exactly why innovation matters and why I will defend it on this show every single time. Somebody spent 20 years and a great deal of money figuring out how to find this disease in a tube of blood. That is a genuine achievement. It arrived too late for Sandy. It has not arrived too late for the 58-year-old sitting in a doctor's office this afternoon telling herself it's just stress or menopause. So here's where I get impatient. We solved the hard part. The science is done. What's standing between that woman and an answer is not a laboratory. It's a coverage decision. And if a blood test is the only thing between her and a treatment that buys her more months at her job, more months in her own home, more months to go to cat shows, more months before her family becomes her care team, then cover the test. The math is not even close. And here's the second thing that would have shut the door on her anyway. She was 58. She wasn't on Medicare. She was on her employer's plan at the Hospital Association. Medicare does not cover these blood tests as screening, and commercial insurance is under no requirement to cover them at all. So think about who that leaves out. The people most likely to be in the early treatable stage, working age adults in their 50s and early 60s, the ones with the most life left to protect, are the people with the least coverage for finding out. We have an FDA-cleared blood test for the sixth leading cause of death in this country, a disease that kills more Americans than breast cancer and prostate cancer combined, a disease whose death rate rose 134% between 2000 and 2024, while deaths from stroke and heart disease and HIV all fell. And as many as half the people who have it have never been diagnosed, not because we can't find them, because nobody is looking and nobody is paying to look. There are two bills in Congress right now, and I want you to know both names because separately, each one leaves half the families out. The ASAP Act, the Alzheimer Screening and Prevention Act, House Bill 6130 and Senate Bill 3267, it creates a Medicare coverage pathway for FDA-approved blood biomarker screening. And let me give you the numbers on this one because they are remarkable. In the House, 181 members as of this recording have signed on. 112 Democrats, 68 Republicans, 1 independent. In the Senate, 47, 24 Democrats, and 23 Republicans. Add that up, 228 members of Congress, roughly 2 out of every 5 people in that building, have put their name on this bill. And it has not moved. It was introduced in November. It went to committee. It is still sitting in committee. So the next time somebody tells you Washington can't agree on anything, this is the thing Washington agrees on. Nearly half of Congress agrees on it. It still isn't law. The Alzheimer's Early Detection Act, House Bill 9823, introduced this July, it goes after the other half, requiring commercial health plans and Medicaid to cover biomarker testing for adults over 50. Pre-Medicare, the stage of life when you're still inside the window. That's the Sandy bill. I mean, it's not really the Sandy bill, but that's the bill Sandy needed, along with the test. Together, these two bills close the gap. One without the other is half the bridge. Now let me deal with objection, because it's coming and it deserves a straight answer. Somebody is going to tell you that most people who get tested won't qualify for treatment anyway. And they're not making that up. Studies of real memory clinics find that only about 8% of new patients and about 20% of those already diagnosed with mild cognitive impairment or Alzheimer's actually meet the criteria. 20%. That's an honest number. But look at what that argument is actually saying. It's saying because 4 out of 5 people won't qualify, none of them should be allowed to find out. I have never accepted that logic anywhere else in medicine, and I'm not going to start accepting it here. We don't refuse to biopsy because most lumps are benign. And here's what gets left out of that statistic entirely. The people who never get counted because they were never worked up. See, Sandy is in that group. Now, granted, she never had these options. But she's not in the 80% who tried and didn't qualify. She's in the group that never got asked. And as I always say, people don't take medicine they don't need. They don't stay on medicine that doesn't work. They take what works and they stop what doesn't. Let doctors and patients sort out who qualifies. But nobody qualifies for an early stage treatment if nobody ever established that they were in the early stage. As I already said, between 2000 and 2024, deaths from stroke went down, heart disease down, HIV down. That is not luck. That is what happens when a country decides something matters and puts 30 years of money, research, and public attention behind it. Over that same period, Alzheimer's deaths rose 134%. 7 million Americans are living with Alzheimer's today. By 2050, nearly 13 million. This year, Alzheimer's and other dementias will cost this country $409 billion in healthcare, long-term care, and hospice. By 2050, that number will be close to $1 trillion. And that $409 billion does not include a single hour of unpaid family caregiving. That gets counted separately. In 2025, it came to $446 billion. So the unpaid work families do is worth more than the entire paid care system. 70% of what this disease costs is carried by families in unpaid labor and money out of their own pockets. We are paying for this disease on the back end, in nursing homes, emergency rooms, lost wages, in all of that unpaid family labor, instead of on the front end, in labs and blood draws. We can do that now. So here's what deciding this would look like. Cover the test. Both bills, both populations, Medicare and commercial and Medicaid. If we have a tool that sees this disease before it takes someone's career, use it. Fund the research at a level that matches a $1 trillion problem. Recognize working age diagnosis for what it is. If someone is diagnosed early enough and the disease is far enough along to end their career, the disability system should meet them there without a 2-year fight. Sandy shouldn't have had to lose that job the way she lost it. Support caregivers as the workforce they are. Respite care, tax relief, paid leave written for a 5 to 15-year illness, not a 5-day one. And write the emergency rules better next time. Whatever the next crisis, someone in the room needs to be asking, what does this do to the person who cannot remember why the door is locked? And then there's the part that's yours. I want to be careful here because this is where these conversations can get a little testy. But we do know more than we used to. The Lancet Commission, the Standing International Panel on this, concluded in 2024 that around 45% of dementia cases could potentially be prevented or delayed by addressing 14 modifiable risk factors across a lifetime. Big number. And let me be honest about what it means and what it doesn't. Number one, it's a population estimate, not a promise to any one person. Do I think someone genetically predisposed to Alzheimer's escapes it because they did the crossword every morning? No, I don't. And I'm not going to stand here and suggest anybody's mother got this disease because they didn't do enough Sudoku. That's cruel and it's also untrue. But let's look at the actual list. Hearing loss, untreated vision loss, high cholesterol, high blood pressure, diabetes, depression, head injury, physical inactivity, smoking, heavy drinking, social isolation, education, air pollution. Read that as a healthcare person. That is not a list of character flaws. Most of that is a list of things you need a doctor for. And several of them are things this country has made genuinely hard to get. Hearing aids, vision care, ongoing management of blood pressure and cholesterol and blood sugar, treatment for depression. Those are coverage fights, every one of them. So when people talk about personal responsibility and access to care like they're opposing teams, on this disease, they're the same argument in two different jackets. So yes, move your body, stay in the world, keep your people, keep working if you want to. Don't let your circle shrink. Get your hearing checked. And if you need aids, get them and actually wear them. Get your eyes checked. Take the blood pressure medication. Wear the helmet. And I'll be straight with you, the evidence is much stronger for staying curious, engaged, and connected than it is for any app promising to train your brain. Do the puzzle if you love the puzzle. My mother loves puzzles. But don't mistake it for insurance. You do these things to change your odds, not to buy a promise. Plenty of people who did everything right still got sick. Or even if they didn't do everything right, they still got sick. Sandy's one of them. But the 20-year window we talked about isn't only a window for finding this disease, it's a window where what you do still counts for something. 2 out of every 3 Americans say they want brain health guidance from their doctor. Only 14% have ever brought it up. So bring it up. At your next physical, ask about cognitive screening and biomarker testing. Whether you qualify, what it costs, what your plan covers. If there's a family history, say it out loud in the exam room. If something feels off and you've been telling yourself it's stress or age or a lot on your plate, get it checked. You may not like the answer, but you cannot act on information you refuse to go get. That's what I mean by be the CEO of your own healthcare. Not that you should have to fight this hard, but until the system changes, the person most likely to catch this in time is you and your family. There is a person behind every patient. With this disease, that isn't a slogan. It's the entire fight. Alzheimer's takes the person first and the patient last. And every single thing we do has to be aimed at the years when the person is still in there. They call it the long goodbye. Sandy never got to say hers, and neither did we. That's the part the phrase leaves out. She had 40 years at a job she loved, and 20 years stolen off the end of a life that should have run to 100 or more. She has 1,000 cats waiting for her, and I'd like to think she's already found them. 7 million Americans, 12 million caregivers, a test that exists in a system that won't pay for it. That's the state of the patient. Free markets should innovate. Safety nets should catch people. This show keeps both honest. I'm Terry Wilcox. Thanks for listening.